Good morning, good afternoon, good evening, wherever you may be. Welcome to OET Medical Online with me, Trevor Gordon, one of your teachers. In this lesson, we're going to give you some help with the information of certain structures in the letters you have to write in the exam. Similar structures are highlighted in the same colour. That's just a reference to what you will be seeing. In today's letter, we're looking at a patient who is going to be referred. Therefore, it will be a referral letter. The patient is suffering from hypertension due to high blood pressure. The patient has shortness of breath, severe headaches, severe anxiety, nosebleeds, in fact 2 nosebleeds in the last 3 days. Also, the patient is experiencing changes in their blood pressure and is taking a range of medications. So we're going to take this information and show you how to create a variety of sentence types to help you with your variation in writing sentences and putting the letter together. We will cover the introduction of the letter with an inclusion of the word referral, refer or referring. All of these words can be used in their different form. This tells the reader what type of letter this is in the introduction, so there can be no doubt. Remember, you want the reader to be aware of what kind of letter it is at the very beginning, so they don't have to wonder or think. So we begin with our introduction. I'm writing to refer a patient into your care for further analysis using a verb. I'm writing this letter to request that a patient be referred into your care. This is passive tense, a patient be referred. The purpose of this letter is to request the referral of a patient to you for further investigation or treatment. So a referral or the referral is a noun. So the reader can see what we're asking for, what the letter is about immediately in one of its grammatical forms. So again, I'm going to say this throughout the video, so it won't be the first time I say this. Practice writing these sentences. When you're doing a letter, you don't have to, every time you practice, you don't have to write a whole letter. What you can do is also practice writing sentences. Eventually, you will be putting those sentences together, so you can practice writing certain structures to improve your sentence writing before you put things together. So remember, you don't have to write a letter every time you practice. Practice the things that you know or you feel you need to improve. And sentence structure is one of those things. We then introduce the patient by using a variety of different sentence structures. In this slide, I've actually put the tense so you can see the differences and the range of grammar. Mr. Capridge is a 41-year-old male who is suffering from hypertension due to high blood pressure. Present continuous, who is suffering. We don't say he is suffering because we've already got his name. If you want to say he is suffering, you would make a new sentence. Mr. Capridge is a 41-year-old male, full stop. He is suffering from hypertension. The problem with that is that you're creating 2 sentences. You don't need 2 sentences here. So the who joins them together. It's a relative clause word, it's called, but it's not part of the structure. Is suffering is present continuous, so that's the main part of it. Mr. Marcello Capridge, a 41-year-old male, has been diagnosed with hypertension due to high blood pressure. present perfect, has been diagnosed. The patient, a Mr. Capridge, is a 41-year-old man with recently diagnosed hypertension due to high blood pressure. Participle adjective. So, to be diagnosed, diagnosed is an adjective, but it's also a past participle, so it's a participle adjective. The name of the patient is Mr. Capridge, who is 41 years old and has hypertension as a result of high blood pressure. So we're just using a connector and we're also using a different terminology, as a result of, because of this, as a result of this, same meaning. The patient's name is Mr. Capridge, a 41-year-old male who we recently discovered has hypertension stemming from high blood pressure. So I forgot to put the colour of that in. So we have a relative clause here, who we recently discovered. The who tells us it's a relative clause, okay? We recently discovered, or we discovered, is a clause, subject and a verb. So again, look at the different types of grammar, because this is one of the things that the examiner will want to see, is your range of grammar. So try and include different ranges where you can. The last part of the introduction is the request. Although this will be repeated at the end of the letter, this tells the letter recipient what you are asking for or what you want them to do. Your assistance in this case would be highly appreciated, using a modal verb would or would be. I would like to request your assistance in this case. Verb and the infinitive. I would like to request. Your help in the further diagnosis and treatment of this patient would be much appreciated. A noun phrase, the further diagnosis and treatment. A phrase does not have a verb. The difference between a clause and a phrase. A clause has a verb, a phrase does not. So, the further diagnosis and treatment. There's no verb in there. I am requesting your assistance for further treatment of the patient. I am requesting. Present continuous. Okay, so this and the previous slide show you different types of grammar structure the examiner will be looking for. Practice these things. You can practice the introduction on its own. Every time you practice, you don't have to write a full essay. Practice things separately and then practice putting them together. From my experience, students tend to just write the whole letter every time, and sometimes they don't focus on the things that they need to strengthen. So there's nothing wrong with writing snippets of the essay to practice certain things. In the first paragraph, we begin to include the patient admission or arrival at the place mentioned in the notes. This should be the first part of the letter, unless there is some history or factor which needs to precede this. So again, you will have to look at the notes. If there's some information that the receiver needs urgently, or needs as a matter of priority, then you should put it before the introduction. The introduction of the patient, not the introduction of the letter, sorry. So, the patient presented to me with the following symptoms: shortness of breath, severe headaches, severe anxiety and nosebleeds, with the nosebleeds having occurred twice over the last 3 days. The patient presented with signs of shortness of breath, severe headaches, severe anxiety, and in addition, he has suffered 2 nosebleeds over the previous 3 days. Upon presentation, the patient was displaying signs of the following: shortness of breath, severe anxiety, severe headaches, and had twice suffered nosebleeds over the 3 preceding days. So here, the colour variation tells you which things have the same meaning. So the purple, the blue, the green, etc. So look at look at how the different ways the same information is being expressed. So this will give you more ideas and more of a range of how to use your grammar. We also add any relevant information after the main factors, like the presentation of the patient. We have the additional information related to the patient's condition. So, in addition to this, he was also experiencing changes in blood pressure, which was last recorded at 150/100. As a result, we have made a provisional diagnosis of hypertension, stage 2. Also noticed was an increase in her blood pressure, which was reading 150/100 when last recorded. A provisional diagnosis of hypertension has been made. An additional factor was a rise in her blood pressure, which was last measured at 150/100, which indicates the possibility of hypertension stage 2. And as you can see, we've provided additional information than the diagnosis in different grammatical forms. The next thing we're going to look at is the patient's medication. There are different ways to include information about medicine and dosage. Depending on the amount of medication needed to be included, what's relevant to the case, we have to decide whether to list it all or provide an attachment. We can also list the most relevant medicine or medicines and refer to a list for the remainder of it. So here are some examples. The patient is currently taking a range of medication which has been attached for your inspection. So I haven't mentioned any medication in my sentence because the list is very long. The patient is currently on a range of medication which includes metformin, atorvastatin, lisinopril and furosemide. Sure, I've pronounced all of those incorrectly, so please, if you have a class with me, please correct me. A detailed list is attached. A list of medication the patient is currently on includes, and then here we have a list: metformin, atorvastatin, lisinopril, furosemide, aspirin, glimepiride, whatever that is, venlafaxine and fish oil. Now this list is probably at the towards the maximum that you can actually write. If the list is longer, as I mentioned in the first example, just say that it's been attached. And additional medication and dosages are attached. So that's another way you could say that there is an attachment. We introduce the patient, and we also provide, and what we also provide includes the medication and attachment information. So again, different ways to express what medication the patient is taking. Then we move on to the past medical history, which will usually be after the current case information. The position of this information will vary, so check the notes carefully. His past medical history is directly relevant as he has suffered from hypertension previously, along with type 2 diabetes, depression, osteoarthritis, and this word I'm not even going to attempt to pronounce. No further information has been provided regarding these. So if you don't have the information, say so. I don't have information about certain things. It's not in the list. It hasn't been given to me. So pass that information on to the receiver of the letter. If you don't have the information, say so, because The receiver might think, why hasn't he or she included this information? Now they know why, because you don't have it. Regarding his medical history, there is a previous episode of hypertension which is directly relevant to the present. Other past conditions include diabetes type 2, depression, osteoarthritis, and that strange word again. His part medical history indicates a previous episode of hypertension which is directly connected to his current condition, along with diabetes, depression, osteoarthritis, etc. Now, the reason I can't pronounce many of these words is because I am not a medical profession. I am a teacher. So my medical knowledge is only what I know from teaching OET. So that is why a lot of these drugs and medicines and treatments with, to me, strange names, I can't pronounce. So I'm sure you guys know how to pronounce them. So I won't try and make a fool of myself. I'll just leave the pronunciations of those things to you. So, the past medical history is generally the same structure as it lists previous information in various forms. Social history will or will not be included. If it is completely non-relevant to the case, then it can be omitted. It should also be in an appropriate position in the essay. So, if you think it needs to be included but it's not that important, it doesn't affect the treatment of the patient, then it can be near the end after the treatment. If it's directly relevant, then it could be before the patient is introduced for his presentation, his or her first presentation. So you have to be the judge of that. But one thing I will say is that the social history does not have to be there. Some students have been told that it must be there. No, it doesn't have to be there. If it's not relevant and it doesn't affect the case, it has no bearing on how the receiver of the letter is going to treat the patient, then you do not need to include it. His social history is unremarkable. He lives with his wife and son, does not drink, but does smoke and chew tobacco. Regarding his social history, he is married and has a son who lives with him and his wife. He avoids alcohol, but does smoke as well as chewing tobacco. Looking at his social history, it is unremarkable. He is married with a son who lives at home, and he smokes and chews tobacco. However, he does not drink alcohol. So this information can be in the paragraph after the introduction if it is directly relevant to the case. If it is not relevant, don't include it. What you've really got to do is, does it give the reader useful or relevant information for him to treat the patient? If it has no bearing, why include it? You don't need to include it. So after this, we'll go to our sign-off. Finally, we have the request for action. What do we want the recipient to do? Clearly state what you want him or her to do. I would like to refer the patient to you for further investigation and care. If you have any questions or require further information, please do not hesitate to contact me. That's also the sign-off. These things should go together. I'm requesting a referral of the patient into your care for further analysis and treatment. If you have any queries, please contact me. If possible, I would like to refer the patient to you for further analysis and treatment, if required. If you have any questions or require further information, please feel free to contact me. Now, when writing your essays, ensure that you use sentence structures appropriately and learn how to paraphrase effectively. If you need to repeat a structure but with different information, practice linking and mixing different types of sentences. These sentences in this presentation will cover many of the grammatical requirements of the letter, including tenses, introduction, linking, verbs, etc. Now here, what I've done for this is I've taken various sentences from each section of the presentation and I've just joined them together. I haven't had to really change any grammar because I've chosen things carefully that fit together, but this is something that you should practice. So I'm writing to refer a patient into your care for further analysis. Mr. Cappridge is a 41-year-old male who is suffering from hypertension due to high blood pressure. Your help in the further diagnosis and treatment of this patient would be much appreciated. There's our intro. Upon presentation, the patient was displaying signs of the following: shortness of breath, severe anxiety, severe headaches, and had twice suffered nosebleeds over the 3 preceding days. In addition to this, he was also experiencing changes, in blood pressure, which was last recorded at 150 over 100. As a result, we have made a provisional diagnosis of hypertension stage 2. The patient is currently on a range of medication which includes metformin, atorvastatin, linezolid, and furosemide. A detailed list is attached. So we've said the presentation of the patient, what we've noted, what we've diagnosed, and the medication. Then we go on to his past history. His past medical history indicates a previous episode of hypertension, which is directly connected to his current condition, along with diabetes, depression, osteoarthritis, and that word again. Okay, so this is the first part of the letter. As you can see, I've indicated the number of words per paragraph. Remember, you need to keep an eye on your words, so you can look at this and roughly see how many words there are. So let's continue. His social history is unremarkable. He lives with his wife and son, does not drink, but does smoke and chew tobacco. I am requesting a referral of the patient into your care for further analysis and treatment. If you have any queries, please contact me. The word count for this is 195, so it's right in the middle of the 180 to 20. Perfect. So practice using different lines, just like I've did. I've taken different lines from different sections and just bolted them together. Again, as I said, you may have to change the structure slightly to get things to fit, but this is good practice for you. Okay, so this is the end of this referral letter presentation. I hope you enjoyed it. I hope it was useful. Please visit our website, oetmedical.co.uk, for more information. If you'd like online tuition, please contact us. You can book classes at booking.oet.co.uk directly. Please subscribe to the channel and share this with your friends, and also hit the notification button. We have 2 channels. There's a channel for students who are studying with us, and a general channel on YouTube. As you know, you're on the channel on YouTube, so we know that already, but there's 2. I'm really highlighting the fact that there are 2 channels. One is for students who are taking lessons with us, who have paid and are taking lessons with us. They have more in-depth videos. The ones on the general public YouTube channel are very useful, and some of them are the same. So if you take lessons with us, you will be provided with automatic access to our other YouTube channel. So thank you. There will be another presentation shortly. Hit the notification bell and you will be told or informed when that is online. So for now, thank you for your time, and please visit our website.